to do is just show you a couple of things. Here is ginger. And this is a couple of health and nutrition things about ginger. And what do you do with ginger? You can cook with it, you can do stuff with it. They put people on a spinning machine. So this shouldn't even have been allowed. This should have been illegal. But they put people on a thing and they spun them for 15 minutes. And then they asked, how many of you people are nauseated? Are you kidding me? With 1,000 milligrams of ginger, the nauseation score was 1.5. This is about 1.5. The placebo that didn't have any ginger, the nausea score was 2.5. And so ginger really worked. It really did help people be less nauseous. And then not just motion sickness, but pregnancy. If you look at the placebo compared to the ginger. So what we have here is that people on the ginger, most of them said none, mild, less moderate, less severe. Those people on the placebo, there were very few of them that had none, mild, then most of them had moderate or severe. It was huge what ginger does for motion sickness, for sickness during pregnancy, for post-surgery. Post-surgery too it worked. And so the goal here is that how do we get this stuff into the diet? Stealthily. Putting ginger into foods, getting it in there so people will eat it. And then garlic. Oh, you gotta love garlic. It is so amazing. It does so many good things for you. They used to, during the war, they would smash it into wounds. And it would reduce infections. It's amazing for doing a variety of things. I knew this, and so I tested it out on my body one time. I was scratching right here, and I was out in the garden, and I got something into my belly, and I started getting this big rash on my back. And I thought, garlic. I took a whole clove of garlic, I smashed it up, and I put it in this patch on my back. I left it there for 24 hours. I read on the internet, don't put fresh garlic on your skin more than 15 minutes or it will burn. I had this huge burn mark on the back of my back. It was massive. You remember that, Rosie? Yeah. It was a painful ordeal. And when I find out something's good for me, I overdo it sometimes. And so I have peanut butter, which I love, and I took a whole bowl of garlic and I smashed it up, and I put it on the peanut butter. And I had peanut butter and garlic sandwich. And I ate it. But it wasn't too bad. And then I started getting heartburn. And I started trying to push it down, and the peanut butter was holding the garlic right there. And I had heartburn hour after hour after hour. It took 5 hours to get it to go down. I took Maalox. Maalox is good for acid, does nothing for garlic. And so, how much do you need? 1 clove a day. You can put it in all kinds of things and make it good for you. What does it do? It makes platelets less sticky, so that they don't tend to stick together for heart disease. It inhibits LDL oxidation, reduces blood pressure, reduces blood lipids. It does amazing things. And the thing is garlic tastes good. People have said for so many years, oh, how come everything that's good for me tastes bad? How come everything that's bad for me tastes so good? But it's not really true. You can take things like ginger and garlic and put them into foods and make the foods really, really, really good for us. And they taste better. Stealthy nutrition. Adding it in and making it a little bit healthier. And you know, garlic has no health benefits unless you crush it. You have to smash it up or it has nothing. And I want to show you this. This is a little complex. I know it's a kind of technical chart here, but what this shows is, this is all studies at the top. These that have standardized extracts of garlic, and these are just non-standardized extracts. And this is the 0 mark. This is at actually reduced cholesterol. So this study, average here, the spread of the data is here. Almost everybody in this study, their cholesterol went down. Here's one, well, it went up a little bit, but the spread of data is over here. And so just non-standardized garlic stuff doesn't do. Look at the standardized stuff. Standardized extract. Reduced cholesterol, and reduced cholesterol. And then if you look at all studies, the same thing, reduced cholesterol. So when people ask me, should I take garlic pills? Well, yeah. But be careful, because some of the garlic pills don't have all the stuff in it. And if you're going to do it, make sure it's a standardized extract. It's really better just to eat the garlic, because it tastes good anyway. You know, why try and do it with a pill? And then I'll quit with this one, because I have lots of them. I just want to show you a couple of them. Turmeric's a yellow coloring. It's the poor man's saffron. How much is saffron for a pound or an ounce? What is an ounce of saffron cost? Because you buy it in like a gram. You get like 10 grams for $5 or something. I don't know what it is, but it's like gold. But turmeric is really cheap, and it gives you the yellow coloring. It's the principal ingredient in curry. And it's got these amazing curcuminoids, which could be more effective than some cancer treatments. And they've done some studies looking at curcumin on cancer, and this is what they found. So they gave these little mice placebo and a cancer-causing agent, and you can see here that all 90% of them got cancer. They gave them this chemotherapeutic drug, and it cut the cancer down by fairly significantly. They gave them curcumin, and it cut it down even more. They gave them curcumin and Taxol, and it cut it down even more. I mean, it's amazingly powerful, potent